name's Olivia. I'm going to be your nurse today. Could you please tell me your full name and date of birth, please?
Yep, Jessica Valles, 5'9" of 95.
Perfect, thank you. And then do you know where you're at today?
I'm at the school.
Perfect. And then do you know who the president is?
Currently Trump.
Okay. So by talking to the patient, I can tell that the patient is alert and oriented ×4 by asking those questions. I can tell that she can hear me at an appropriate distance, and she can hear and respond clearly, and she does not appear to be any distress when speaking. Patient was wearing a sweater, but I asked her to take it off for this assessment. She seems to be dressed appropriately for her age and the season, and she, by the looks of it, appears to be well groomed. I will note further in the inspection for any lesions or nevi that I will note, but just based on what I can tell, she does have scattered nevi bilaterally on her arms. So first, I am going to look at her head. I can tell that her head sits midline, it's upright, and it's still. Her hair, based on what I can note, appears to be thick and smooth. Her head is normocephalic. Her scalp appears to be in good repair. Her hair is a dark brown with a hint of blonde at the bottom of it. I'm just going to palpate, and can you tell me, do you have any pain or tenderness?
No.
No? Perfect, thank you. I do not know any redness, lesions, or bumps during palpation, and there's no tenderness indicated by the patient. I'm going to feel for your sinuses. Can you tell me, do you have any pain here?
No.
And what about right here?
No.
Perfect. So I will note that there's no redness, lesions, pain, or tenderness on her frontal or maxillary sinuses. Next, I'm going to test your TMJ. Can you open, close, open, close? Perfect. Did you have any pain or tenderness?
No.
Okay, so I will note that the patient did not have any pain, tenderness, crepitus, or popping when palpating the TMJ. Next, I'm going to move on to her eyes. So based on what I can note, her eyes are symmetrical, and they are, can you open and close your eyes for me? Perfect. So her eyelids have the ability to open and close bilaterally. Her eyebrow distribution is equal with a brown coloring. Her eyelashes are growth outward. Her iris is brown in color. I would rate her pupil size approximately 3 millimeters in size. Her sclera is white. I'm going to test to see your lacrimal puncta is free of exudate. I'm going to get my pen light. Just look. Perfect. So cornea is clear and conjunctiva is pink. Next, I'm going to test for perilla. Now you stare at this pen for me, please. Perfect, thank you. And then could you just stare at my nose? Perfect, thank you. Next, EOM. So can I have you follow this for me, please? Perfect. Thank you. So I just tested EOM and perilla. Perilla is present and EOM is intact. Now if I could just have you stare at me, I'm going to test for corneal light reflex. Perfect. So right now I was just looking when I was shining the light in her eyes. Her eyes accommodate because there's a reflection of the light equal in both eyes. I don't know if I mentioned this already, but eyes are symmetrical. Okay, I think that was it for the eyes. Next, I am going to look at your ears. So I'm going to know, I do not know any redness on either ear. Do you have any pain or tenderness here?
No.
No? What about right here?
No.
And any pain here?
No.
Perfect. So I will note that there's no exudate. There's no pain, tenderness, or redness on either ear. Next, I'm going to move down to your nose. Can I just have you remove your mask down? Perfect. So right now I can note that the nose is symmetrical. I do not note any redness. I'm just gonna feel. Do you have any pain here?
No.
What about right here?
No.
No? Perfect. What about right here?
No.
Perfect. I will note that there's no pain, redness, or tenderness on the nose. And like you said, it is symmetrical. Can I have you just close one nostril and breathe in? And can you do the same to the other? Perfect. So just test it for patency. So nose is patent. Next, I'm gonna have you remove your mouth. Do a face mask, and I'm gonna test for facial expressions, and then I'll move to the mouth. So can I have you smile, stick out your tongue, move it side to side, and then puff your cheeks, raise your brows, and squint your eyes. Perfect. So I just tested for facial expressions, and she was able to do so on command. So next, I'm gonna move to her mouth. So I'm getting my my tongue depressor and my light. So based on what I can see, her lips are symmetrical. They're dry in the normal range. And I'm just going to have you open. Can you say ah? Perfect. So uvula rises midline with phonation. I will note that the hard palate and the soft palate are pink and moist. I do not note any lesions. I will note that the pharyngeal wall and buccal mucosa are also pink and moist. Tongue appears to be symmetrical, pink and moist, no lesions present. Can I have you lift up your tongue for me? Frenulum is intact. Again, I do not note any lesions. And can I have you just show me your teeth? So gingiva is pink. Teeth are in good repair, and the teeth adhere to the gingiva. I think I'm good. So thank you. Perfect. Okay, next, I will move on to the neck. So I'm going to know all of her lymph nodes. So she has her preauricular, postauricular, occipital, submandibular, submental, tonsillar, and then you have your anterior, deep, and post-cervical, and then also sternocleidomastoid, and then you have your supra and infraclavicular. Based on what I can tell on inspection, she has a few scattered nevi on her neck that do follow the ABCs and do not have any abnormalities need to be noted. Based on what I can see, my hands are cold, I'm sorry. The trachea sits midline. There are some ridges, which is not a bad indication. I do not know any goiter. Can I have you look to your left and look down for me, please? Perfect. Right now, the thyroid gland is not palpable, which is a good indication. Now can I have you look to your right and look down? Perfect, thank you. Again, thyroid gland is not palpable. I do not know any lesions, redness, edema. Do you have any pain or tenderness from what I'm feeling? No? Perfect, so I will note no pain or tenderness indicated. And you can look back at me. So good there. So next, excuse me, I'm just going to test. Can you shrug your shoulders for me? Perfect. Excuse me. So I just tested the strength of her sternocleidomastoid and the trapezius as she shrugged. Next, I am going to can I have you try to turn your head? Perfect. And again, perfect. So again, that was testing the strength with the sternocleidomastoid and trapezius. And I would rate that out of 4, very strong. Next, I will move on to the range of motion of the neck. So can I have you tuck your chin to your chest, and then head all the way back, and then can you touch your ear to your shoulder? And then can I have you just do a rotation around, and the opposite way, please. Perfect, thank you. So range of motion is intact for the neck. And okay, I think that's good for the neck. Next, I'm going to move up to her upper extremities. So I will note that there is equal hair distribution bilaterally on both of her arms. There are some scattered nevi, again, that do not need any further indication with the ABCDEs. Her skin, sorry, my hands are cold, pink, warm, and dry. I'm going to just look at your hands. So there is no clubbing indicated, what I can see from her nails. Her nails adhere to the nail bed. Her nails are pink and smooth and strong in texture. They appear to be well cleaned. I'm going to test for your capillary refill. Good. Good. Capillary refill is less than 2, well, technically less than 3, but, and again, her hands pink, warm, and dry, a little clammy.
Yeah, they're a little clammy.
Making you nervous. Can I have you test for strength? So squeeze, perfect. So just test it for hand strength, and can I have you just have your hands out like this? Can you push up? Can you push down? And then can you have your hands like this? Can you try to push out? Perfect, and can you push in? Awesome. So I just tested for hand strength, which I would rate at a 4. Next, so let's see. I'm gonna do range of motion of the, I can't say, I always butcher this, metacarpal phalanges and the wrist. So can I have your hands up, and can you touch each finger to your thumb, and then backwards? Perfect. And then can I have you spread them, and then close them, and then can I have you put your thumb to your pinky, and then can I have you wave? Perfect. And then can I have you do this and point down? Perfect. And then can I have you make a fist and then out? Perfect. So I just tested range of motion of the wrists and metacarpal phalanges. Next, while we are at the upper extremities, we're also going to test the strength of the bicep and tricep. So can I just have you put your hands up? I'm just going to grab your wrist. Can you try to push towards me? Perfect. And can you push towards a pole, I guess? Perfect. Towards you. So I just tested the strength of her bicep and tricep, which I would rate, again, at a 4. And then next, we'll do range of motion of the shoulders. So can I have you put your hands to your up, and then hands back down, and then can I have your hands out behind your head, then back down, and if you could, out, perfect, and then behind your back like you're getting arrested. Perfect. Thank you. So tested range of motion of the shoulders, and next I'm going to also do the elbow while we're here. Now you have your arms out, and can you flex them? Perfect. And can you put your hands like this, and then can you turn them? Perfect. Thank you. So I just tested range of motion, again, previously of the shoulder and the elbow. So range of motion of the shoulder and elbow are intact. And next, I am going to move on to her bicep and tricep reflexes. So I'm going to get the hammer. And so I just need you to relax your arm for me, okay? Good. Here, one more time. Good. And then next, so I'm going to just do them both at the same time. So just relax your arm for me. Good. So on the left arm, I will rate the bicep and tricep reflex at a +2. So just relax. Okay, one more time. Perfect. And then I'm going to do this again. Relax your arm for me, please. Good. So I just went through the motion of her bicep and tricep reflexes on both arms, and I would rate both arms at +2 for reflexes for the bicep and for the tricep. Okay, so with that, I will move on to her posterior. So if I could just have you turn, there we go. I'm gonna make sure the camera can see you. Okay, I'm just gonna move this. Okay, make sure I'm not in the way. Okay, so I'm gonna mark the landmarks. So you have your vertebral line, you have your scapular line, then you have your 7th rib, and then you have your 12th rib, and then mid-clavicular line, and you have your C7 and T1 up here. So pink, warm, and dry for the skin. Again, on the posterior aspect, she does have some scattered nevi, which again, do not need further finding with the ABCDEs. I'm gonna just have you, can I have you breathe in for me? And out. Perfect. So I will note that the chest expansion is equal bilaterally. Again, I do not note that the patient is in any distress. Next, I'm going to test for CVA tenderness. Can you tell me, do you feel any pain here?
No.
No? And what about here?
No.
Perfect. So I will note that there is no CVA tenderness or pain. I'm just going to feel for your scapular. Okay, so by doing that, I will note that the patient has the spinal curvature, which is good, not an abnormal finding for any other further indications. Okay, I believe next I'm going to move on to auscultation. So every time you feel my stethoscope on your back, I'm just going to ask you to breathe in and out for me, okay? Perfect. Can I have you breathe in? Perfect. Breathe in for me, please. Out. Sorry, I'm going to have to breathe in. Perfect. Out. Breathe in. Good. Breathe in. Out. Last time, breathe in. And out. Thank you. So I will note that I did not note any abnormalities. Her breathing is clear and the patient does not appear to be in any distress. So lung sounds are clear in the posterior aspect. If I could just have you swing your legs. So I will note that AP to transverse is 1 to 2 as well. Next, okay, I want to make sure they can see. Oh, that's a nice angle. Just gonna do that. So next, I'm going to view her anterior aspect of her chest. So I will identify landmarks. You have your sternum, you have your xiphoid process, you have your mid-clavicular line, and then you have, well, I guess I'll do it this way so they can see. You have your anterior, mid, and posterior auxiliary line, and then you have your supra and infraclavicular. So again, I think I said this already, but patient has scattered nevi that do not need further noting or finding with the ABCDEs. Based on what I can see right now, I do not see any distress from the patient. She does not have any retractions or pulsations noted. And pink, warm, and dry. So next I'm going to auscultate. Okay, can I have you breathe in? And out. Breathe in. And out. Perfect. And I'm just going to go underneath your shirt. Breathe in for me. Out. Breathe in. And out. Thank you. So I will note that the patient, her lung sounds are clear on the anterior aspect. And next, I'm going to move on to heart and vascular. So I'm going to ask you to lay down. And I will have you, if you could
Tell me if this is a good angle.
Okay.
So you see.
Right there. There you go.
Okay.
Looks good. Okay. So with heart and vascular, I will note that I do not note any lifts or heaves right now. There are no thrills present. And again, I already said this with the anterior, but she has scattered nevi. I will identify the landmarks. So you have your aortic, you have your pulmonic, Erb's point, tricuspid, and mitral. So mitral is also known as your PMI. So right now I'm just gonna palpate it. Perfect. So PMI is not palpable, which is not an abnormal finding. So I will next, before auscultating, I'm just going to listen to her carotid pulses. So I'm going to do them one at a time. Perfect. Dang, I felt them fast. So carotid pulses are at +2. Yes, okay. So good. Next, so I will do radial pulses in a minute because right now she's holding the camera, but I'll do them bilaterally after this. So next I'm going to auscultate. And so with auscultation, you can use the bell or the diaphragm. And you'd want to use the bell if there's any murmurs present. And one last time. Perfect. So no murmurs were present, and I will note that the S1 was best heard at the apex, so in the mitral, and S2 was best heard at the base between the aortic and the pulmonic. Okay, I guess while we have the camera, let me
make sure it's a good angle.
So I'm just gonna lift up your stomach. Let me look. Okay, so now we're just going to move right there. Okay, okay. So next we will move on to the abdomen. So right now, what I can tell, the patient has a flat stomach. I do not see any hernias. Can I have you do a little crunch for me? Perfect. So doing the crunch, I can note that I did not note any hernias present. Just gonna feel. Patient's skin is pink, warm, and dry. I will note there are some scattered nevi. Again, they do not need to further be assessed because they do not have any of the A, B, C, D, E findings. So next I am going to auscultate. Perfect. So I will note that there are bowel sounds in all 4 quadrants, which is a good finding, and if they were absent, then I would make sure to listen for up to 5 minutes before marking it as absent. Next, I'm going to percuss, so I'm just gonna perfect. So I percuss the abdomen. So I will note that more in the upper quadrants that it was more of a timpani sound, and in the lower quadrants it was more of a dull sound. And next I'm going to palpate. So I will ask, do you have any pain or tenderness anywhere?
Nope.
No? Perfect. So I'm just gonna feel pain here?
Nope.
What about up here?
No.
No? Right here?
No.
No? Right here?
Nope.
Perfect. So I will note that the patient does not have any pain or tenderness during palpation. And I think that is good for the abdomen. Perfect, thank you. So I'm just gonna hold this for a second because we'll move to lower extremities. But I realized I forgot to note about the patient's tonsils. So I'm just gonna backtrack for a second. I don't know how to do it. Perfect, thank you. Can I have you remove, just pull your mask down? Can you open? Perfect. So I will note, it appears that the patient had a tonsillectomy. So I will note that her tonsils are at a 0. Perfect. Okay, sorry about that. I just realized that.
You're gonna hold it for.
Yeah, probably here. good angle?
Yeah.
Okay. Thank you. So I will note the patient's skin is pink, warm, and dry. Again, there's some scattered nevi that do not need further assessment because they do not have any further indication of the ABCDE. I do not know any edema, redness, or swelling. Do you have any pain or tenderness?
No.
No? Okay, perfect. So next, I'm just going to look at a capillary refill. Capillary refill is less than 2. Less than 2. Perfect. And I will note that so capillary refill is less than 2 bilaterally on both lower extremities of the toes. I will note that the patient does have nail polish on, so I cannot tell if her nail bed is pink, but they do appear to be smooth and strong in texture. I do not know any clubbing present. Her nails do adhere to the nail bed. And I believe that is going to be it. So next I'm just going to do range of motion. Can I have you point your big toes towards each other? And can I have you point the big toes out? Perfect. And then can you point your toes to your nose? And then point your toes down? Perfect. So I just tested range of motion of the ankle. Next I'm going to test the range of motion, the strength of the ankle. So can I have you push your toes on the gas? Perfect. And then can I have you put your toes to your nose? Perfect. So I just tested the strength of the ankle, and I will note that the strength is at a 4. And next I'm going to feel for her pulses. So okay, so her tibial pulse is at a +2. Now I'm going to feel for a dorsal pedius. I don't know how to say it, but dorsalis pedius, I think it is. Perfect. So her dorsalis pedius is at a +2 as well, equal bilaterally, as well as the tibialis pulse as well. Next, I'm going to go ahead and get the hammer. Actually, before we get the hammer, I'm just going to raise this. So, your feet dingle a little bit. So I'm just going to do something, and you just tell me if you have any pain, okay?
No.
No? And what about here?
No.
Perfect. While I have the patient here, I'm going to test for the Babinski test. So. Okay, so Babinski test is present, which is good. I also meant to say that when we tested for this, we were testing for the Holman's test, and that was negative, which is good because she did not have any pain when I flexed her ankles. Okay, so I'm going to have you just relax, and so I'm going to do your I am going to do your patellar reflex. There we go. Good. Good. So patellar reflex is at a +2. Next, I will do the Achilles. So I'm just going to test. So I'm just going to gently flex. Do it again. Perfect. And then Achilles. Good. So, I already said the patellar. So I just tested the Achilles reflex, and that was at a +2 as well. And then I'm going to test the strength of her quads and of her hamstrings. So I'm just going to grab her ankles. Can you try to point your toes towards me? Strength. Perfect. And can you try to push your heels towards you? Perfect. So I just tested the strength of her hamstrings and quads, and they were at a 4. And okay, I'm just gonna set the phone back down because I need to test the patient's radial pulse from earlier. Perfect. So this was for the heart and vascular. It was supposed to be with the carotid pulses, but the patient was holding the phone for me. So I'm just going to feel for her radial pulses. Good, that one's strong. Ooh. Perfect. Radial pulses are at a +2, which is good. And next, I'm going to ask the patient if you could stand up for me, please. And let me make sure the ankle's good. Can you scoot back right there? Awesome. So if I could, can I have you kick your butt with your legs? Perfect. And then can I have you maybe just do a squat? Perfect. So I just tested the range of motion of the knees. So range of motion is intact. Next, can I have you just walk a straight line? Perfect. So I will note that the patient has even cadence, and I do not note any distress in her posture and gait. And next, can I have you just stick your arms out and close your eyes? Perfect. You're good. If you can go ahead and sit back down. I will note that, so we just tested for the Romberg drift test, and that's a sign of a stroke, and she does not have that, which is a good indication. Okay, I believe I'm done. I'm just gonna look at my sheet to double check if I missed anything. Okay. Sorry, just double checking. Okay. Perfect. Okay. The only thing, I don't think I did this properly. I'm just gonna feel for your ears. I need to do them bilaterally, and I did them one at a time. Do you have any pain or tenderness here?
No.
What about back here?
No.
And what about right here?
No.
No? Perfect. So I will note no pain or tenderness in the ears and the mastoids in the preauricular, in the auricular itself. Okay, I believe that is all. Thank you.
Scan the room.
Oh yes, scan the room. Thank you. Okay. So again, and then we were told we can look at our sheet once. Perfect. Thank you.